Saki Foundation, Code for Boston, the Engagement Lab at Emerson College, the Northeast Big Data Innovation Hub, and the Metro Lab Network. Last, I want to thank the conference committee by name. I don't normally do this at the beginning of the conference because they're written out by name in the program, but none of you have a program. So I'm just going to name them. We'll spend an extra moment doing that, but just going through. So thank you to, and these are the individuals who reviewed all of the proposals, who developed the call for proposals, who helped us figure out what the conference needed to be this year in order to properly serve the community. And includes Amy Sprung, Director of Strategic Partnerships, Airband US at Microsoft. Eric Gordon, Professor of Civic Media at Emerson College and the Director of the Emerson Engagement Lab. Esteban Moro, Visiting Professor at the MIT Media Lab and Associate Professor at Universidad Carlos III de Madrid, Spain. Catherine Lusk, Co-Director of the Initiative on Cities at Boston University. Kim Lucas, the Senior Director of Civic Research and Innovation at Metro Lab Network, and who got roped into all this in her previous position at the City of Boston's data analytics team. Elizabeth Hess, the Executive Director of the Institute for Quantitative Social Science at Harvard University. Luke Schuster, the Director of Boston Indicators at the Boston Foundation. Ted Landsmark, Distinguished Professor and Director of the Kitty and Michael Dukakis Center for Urban and Regional Policy at the School of Public Policy and Urban Affairs at Northeastern University. Tim Reardon, the Data Services Director at the Metropolitan Area Planning Council. And Elizabeth Langdon Gray, the Executive Director of the Harvard Data Science Initiative. So that's our conference committee. And very much appreciation and gratitude goes to them for all of their work in putting this together, and also all of their brainstorming in the last 6 weeks as we figured out what to do in this situation. And then last, I want to thank Jenny Stevens, the Director of the School of Public Policy and Urban Affairs at Northeastern University, and the entire staff there for their support throughout this process. There's a lot that goes on behind the scenes that they're very helpful with, very supportive with. And the last two groups I want to thank, the whole BARI community, first off, just all of you, right? Everyone on this webinar right now, everyone who has been so immensely understanding and gracious and generous in communications over the last few weeks, and flexibility of everyone who submitted proposals. And we basically had to tell, we don't know what we're doing yet, but we're going to do something. And then kind of sticking with us through this. And I really appreciate that. It's been nothing but collegiality. And it's just been a wonderful set of conversations over the last 6 weeks to get to where we are right now. And we couldn't have done that without everyone's commitment and partnership. And then last, but certainly not least, actually probably most, I want to thank Will Pfeffer. All of you have been in communication with him at some point through email. Will is the guy who makes this go. He makes the trains run on time. He corrals on a regular day one academic, which is me, and on a day like today, hundreds of academics, which is a daunting task. So I need to give him the greatest kudos in the world for making this happen and for really executing on this plan that everyone's come up with together. And he has a new title along with program coordinator. He's apparently executive producer of the BARI podcast. So thank you to Will for all of that and making this happen. So I want to dive into today's panel with that. And I've taken too much time out of it, and it's going to be a great conversation. Today's panel, as you all know, is on the other impacts of Corona, right? This theme for the conference now, and this idea that I've already spoken to. So I'm going to intro it very briefly, but this concept that, right, we just shut down our communities. We shut down a system of systems, and all of those systems are being exposed right now. They're languishing at some level, and we're discovering ways in which we need to prop them up and to support all the people who depend on all of those systems. And I'm going to introduce the panelists in just a moment. I just want to note, in terms of protocol and run of show, we have a Q&A that everyone, all the participants, attendees can participate in. Shoot your questions there. We are monitoring that, and then that will be brought to me, and then I will ask questions as the moderator. So we'll draw from there, and especially questions that come up more than once. If people want to sort of knock on or co-sign a question, if you really want it asked, let us know, and we will take care of that. Also, we are monitoring Twitter, so tweeting at us or tweeting, so at BARI Boston, or tweeting hashtag BARI 2020. That will get to us as well. So we're monitoring all those things, and then that'll be filtered up to me, and then I'll ask questions as the moderator. If you want to provide your identity when you tweet or ask in the Q&A, please do. I'll be happy to ask on your behalf. I think that is useful in kind of reminding everyone that we're not just all individuals sitting in front of a screen. We are a community having this conversation together. So with that said, I want to dive right in. We have four fantastic panelists today, each one an expert in a different domain, a different one of these systems. And I'm going to introduce them very briefly, and then in the order that they're going to speak, and then we're going to dive right in and give each of them the ability to kind of start us off here. So first, we're going to hear from Alicia Sasser-Modestino. She is Associate Professor of Public Policy and Urban Affairs at Northeastern University, works right down the hall from me, and also the Associate Director of the Dukakis Center for Urban and Regional Policy. And she is an expert in labor economics, among other things. And she's going to talk to us today a bit about how the labor market has been disrupted. Nancy E. Hill, the Charles Bigelow Professor of Education at Harvard Graduate School of Education. She's also the Director of Research on Education for BARI, close collaborator, has led a lot of really good work on equity in access to quality education, and a real expert in how parents and families interact with schools. And so she'll talk a bit about primary and secondary education at this moment. And then we'll go to Taylor Kane, who is the director of the Housing Innovation Lab, which is nestled at the Mayor's Office of New Urban Mechanics for the city of Boston. And she has been there for nearly a year now, really starting up this really innovative initiative, not to steal the word from the name. And she is right in the thick of figuring out how to imagine new ways to support Bostonians in the maintenance and search for housing. And so very much looking forward to her expertise there. And Rebecca Gewertz, Executive Director of the National Association of Social Workers Massachusetts chapter. She is herself a social worker and will be able to speak to us not only about the mental health, right, the services that the social workers themselves offer, but we'll also talk a bit about the social services that many of the people that social workers support, that social workers then help them to get access to as well, and kind of the wraparound idea of the support that we all need, especially at a time like this. So with that, everyone's going to give us a quick bird's eye view of what their area looks like, and then we'll dive into kind of more cross-cutting conversation. So from there, I'm just going to turn over to Alicia. So Alicia, what does the labor market look like right now? Dare I ask?
Well, yeah, well, Dan, it's not pretty, but I'm going to try to put it in perspective, because I think the sky is falling, but we might have some ways to put the pieces back together, and how long it takes us to do that, right, will really depend on certain factors. So thanks very much for having me. Dan gave us 3 minutes, so I'm going to whip right through a lot of economic statistics that are going to make your head spin, but happy to answer any questions during the Q&A. So since the last few weeks of March, the US has experienced a sudden and drastic job loss on a scale that's really not been witnessed since the Great Depression. So for example, new weekly claims for unemployment insurance for the week ending March 7th were on the order of 200,000. And just 2 weeks later, after many states began shuttering restaurants and other non-essential businesses, new weekly UI claims had skyrocketed to 3.3 million, and then peaked at 5.2 million by the end of March. That's an increase of over 3,000%, and far exceeding anything we saw during the Great Recession in 08-09. And although new unemployment insurance claims have since declined somewhat this week, the cumulative impact over the past month has resulted in more than 26 million Americans applying for their first round of unemployment insurance, with likely millions more unable to apply or not qualifying for benefits. And we've seen a similar trajectory here in Massachusetts, with new UI claims rising from about 5,000 a week in early March to roughly 180,000 a week at the end of March, before declining to only 80,000 or so this week. However, Google Trends show us that while traditional UI claimants are declining each week, self-employed workers seeking special PUA benefits that are new are on the rise. So watch out for that next week. Now, by most estimates, the current unemployment rate stands somewhere between 10,000 and 20%, or 10% and 20%, depending on whether you count furloughed workers as job seekers. The Massachusetts Taxpayer Foundation is projecting that the Commonwealth will lose 570,000 jobs during the second quarter here, resulting in an unemployment rate of up to 18%. And the future path of the unemployment rate will really depend on how many furloughed workers are recalled when the economy reopens. This could be as many as 2/3 of those who are currently out of work, which would result in an unemployment rate of only 7% this time next year, if those firms do not go out of business in the meantime. Yet economists are not predicting an end of days scenario, but rather that this downturn will be sharp but short. Most of my colleagues are split on whether the recovery will be V-shaped or U-shaped, but most economists predict that we will see some economic growth resume in either the third quarter or the fourth quarter of this year. But that is assuming a best case scenario, that we reopen the economy safely without causing another public health shutdown. In contrast, the Great Depression lasted 12 years and the Great Recession lasted 7 years. So again, keeping everything in perspective, this should be a very sharp, but hopefully a very short downturn. At the same time that we've seen heavy job losses in certain industries like hotels and restaurants, there's actually been strong job growth in things like grocery stores, warehouses, and home delivery drivers. Even in healthcare, we've kind of seen this dichotomy where elective procedures have been put on hold, furloughing pediatricians and podiatrists and dentists. Yet frontline healthcare workers like certified nursing assistants, nursing home attendants, and respiratory therapists are in high demand. Most economists think that layoffs will bottom out in May or June, but that will really depend on the supports that we put in place now to sustain both individuals and businesses between now and when the economy recovers. The latest stimulus package replenished the small business fund with another $250 billion, but it's really essential that the money be targeted towards small establishments and nonprofits that missed out on the last round and for whom bankruptcy is only a week or two away. And similarly, although we've increased the duration and the generosity of federal unemployment insurance benefits, it's really essential that cities and states continue to provide rental and food assistance for those who need it. Now, whether the recovery is V-shaped or U-shaped, it's going to be a long road back to full employment that's going to extend into 2023. The Great Recession taught us that Main Street does not recover as quickly as Wall Street. And even though there's pent-up demand for haircuts, eating out, shopping, every business is going to need to put in place social distancing measures that will limit their capacity and slow hiring. And these current projections that we're talking about here assume that there will be a subsequent COVID-19 stimulus package in the fall that will help us beyond what we've already seen. There are reasons to think that Boston, Massachusetts will actually suffer greater economic disruption than the US. Moody's Analytics lists both Boston and Massachusetts among the most vulnerable metro areas to the pandemic effects. And in part, this is because we had an initially high exposure to the virus, stemming from both international travel as well as the Biogen conference. So as a result, we prudently put in place much needed social distancing measures right away and more quickly than other states. But that means our economic downturn will be much steeper and longer. And our demographics are really stacked against us here, with having greater density, a larger share of the population over 65, and high levels of migration. Also, the industries that are most affected by the pandemic, healthcare, education, tourism, are some of the key drivers for our economy. Finally, I can't stress enough that the economic crisis is really tied to the public health crisis. This is not a trade-off between lives and livelihoods. The two are completely intertwined. A reopening of the economy without widespread testing and contact tracing in place to contain future outbreaks will simply mean future lockdowns and erosion of consumer confidence that will lead to voluntary social distancing out of fear of contracting the coronavirus. It's essential that governors coordinate and manage the process of bringing the economy back online with the help of public health officials to guide every step of the way. Otherwise, projections show that the loss of GDP will be twice as severe if there is a prolonged outbreak in 2020 and 3 times as severe if there's a new outbreak in 2021. So all to say, if we do everything that we're supposed to be doing and we reopen the economy smartly, we could keep this to just a sharp but short downturn in the economy.
All right. Thank you, Alicia. That was, I want to say great. That was also extremely sobering.
Yeah.
So, but thank you very much for that. I want to turn now to Nancy. Nancy, can you give us a sense of kind of the bird's eye view for primary and secondary education?
Yes, thank you, Dan, and thank you, Alicia. The education system and the labor market, of course, are also intertwined. The pandemic has fully disrupted the education sector, as we know, and with Governor Baker's announcement that schools will remain closed for the rest of the school year, school leaders, teachers, and families are cobbling together learning for the rest of a student's current grade. When we thought this would be a matter of weeks, schools put together enough materials and packets to, at best, maintain instructional gains. However, finishing the academic year remotely brings deeper challenges in both the short and the long term. And the questions loom about how and really whether instruction can be made up, how much learning will be lost, and how vast the disparities and variabilities will be when we return. And it raises really three issues that I want to talk about today, and hopefully we can discuss further. One is first the immediate inequities that were brought to bear. The move to home and online instructions brought to light and magnified inequities across districts and families. From the start, districts that are serving families from more disadvantaged backgrounds were required first and primarily to focus on securing the continuance of the basic resources that so many families and students receive from the school system, whether it's access to free and reduced price meals, access to mental health services and other resources. That schools and school buildings aren't just about education, they are community centers where families access resources. And so while some districts were focusing on that, wealthier districts could focus first and foremost on how to move instruction online. And when poorer districts were finally able to focus on instructions, there were many more barriers that were brought to light, that parents in these districts had fewer resources and less flexible jobs that they could provide support to students in the home learning context. I mean, just getting access to hardware and internet service. In some ways, as we saw, pictures and news articles of the delivery of Chromebooks and access to Chromebooks, that part's actually the easiest part. But providing the technological assistance to achieve internet literacy is much harder to achieve. Families with little experience and access to the internet and web conferencing software can't help their students, their children at home when there's snags in access. And further, for families for whom English is not their first language, which is so many families in the Boston public schools and in the greater Boston area, they're attempting not only to gain access to the online learning platform, but then learn the material all in a foreign language. And it means that many of their parents aren't even able to help because they can't even read some of the instructions on the computer screen. And so that's just the first part where we see just vast inequities in the startup and in the maintenance going up, right from the start. But then as we look ahead to reopening the schools, some have feared, and we see news articles that this is going to result in a lost generation educationally, that some students are going to be left behind and their education stunted in a way that we might not recover. And I think that that's not a foregone conclusion. And I think conferences like this and people coming together to really actively work against the notion of a lost generation educationally. We can't give up on students. Students are going to return to school in the fall with a wide variability in their grade level knowledge. And an attempt to fit students into a one-size-fits-all system of grade levels that commence and end with the academic year, if we attempt to do that, we're going to fail. We're going to fail a society and we are going to fail the students. We must remold the system. And come fall or summer or whenever we're able to come back and really engage students in education again, there needs to be an intense focus on assessment. Assessment to determine what students have learned, what they have retained, and to identify gaps in their knowledge and skill. And then this needs to be followed by targeted and differential instructions that meet students where they are. And teachers can't do this by themselves. We need multiple systems in place. And secondly, and equally importantly, as students come back to schools, we need to focus intensely on students' mental health and address the potential trauma and challenges that they've experienced while they've been impacted by the pandemic. And the third thing that I want to talk about and bring into the discussion is to look well into the future, past post-pandemic. And as Dan, as you described in your opening remarks, we don't want to go back to status quo and we don't want to go back to what wasn't working before. And we have an opportunity here to really remake the educational system to better serve students and to better prepare them for today's society. I mean, the school system we have was already broken in many ways and not fully preparing youth for the future or for the economy and the job market that we currently have. And the pandemic has exposed those cracks. And I think we can first and foremost really deal with the digital divide and access to the internet, access to technology, and internet literacy. And we can focus on providing those technological supports. And in doing so, we can launch into more personalized and differentiated learning that meets students where they are and brings them where they need to be and can help them cultivate their identities, their sense of purpose, and connect them to meaningful careers and lives. So using technology not just to close the learning gaps, but to more intentionally help students learn and see the relevancy and purpose of the work that they are doing. And so I'd like to see us really think about how we can remake the educational system to tie it to what today's current job market needs in terms of preparing students for the future and not miss this opportunity to go back to schools as we had them before. Thank you, Dan.
Thank you, Nancy. And I'm already seeing in these first two talks a lot of really interesting threads, but in particular this return to kind of Nigel's premonition, right? There may be no going back. There's only going forward, but I won't editorialize too much before we get all the way through. So I want to turn it over to Taylor. Taylor, can you give us a similar bird's eye view of what's going on in the world of housing right now?
Yeah, definitely. And thanks, Dan. So many connecting threads between all of the things that we're talking about today. So in many ways, COVID-19 has exposed the fault lines that we always knew existed in our housing market. Whether we were talking about our housing crisis, our affordable housing crisis, or our chronic housing shortage, COVID has put an already untenable situation involving networks of renters, landlords, and investors on full display. Before COVID-19, many households struggled to access affordable housing and experience housing stability in the US. In 2019, the National Low-Income Housing Coalition found that there were no counties nationwide where a renter working 40 hours a week at minimum wage could afford a 2-bedroom apartment. This is a national story that we know plays out locally as well. In 2018, in our update to Boston's housing plan, the city called attention to the 34,000 non-student renter households who are severely cost burdened and face difficulty paying rent each month. Before COVID-19, we were also aware of the alarming divide between our population growth and housing production. We witnessed Boston's population increase by 51,000 people between 2010 and 2017, but we only built enough housing to accommodate 37,300 people. The strains that are faced by renters, the high cost of housing, and the quality of our relationships between property owners and tenants offer evidence of the imbalance of power that really defines our housing market. It thus is really no surprise that housing, which was a deeply contentious and personal issue before COVID, continues to be a source of much concern and debate. In this time of widespread job and income loss, housing instability has intensified for those who are already on the margins, but it has also pushed new households into vulnerable positions. And an understanding of our ecosystem, our housing ecosystem, its relationships, and its response to this very acute shock must define the solutions that we explore. So there are lots of ways to think about the fault lines that exist in our housing market. But the piece, or rather set of actors that I think it's really important to start with is renters. Boston has over 289,000 housing units, or as I call them, homes, and around 172,000 are renter occupied. Renters contribute to every facet of urban life. They patronize local businesses, they send their children to schools, we work jobs that support the many qualities that we appreciate about cities. At the same time that renters bring immense value to the city, they are also incredibly vulnerable. They were vulnerable before this moment. They're incredibly vulnerable during this pandemic and for the foreseeable future. It is not a coincidence that in Boston, many of the industries that have been hit hardest by COVID also happen to be industries where workers are more likely to be renters. It is similarly not a coincidence that renters are more likely to be people of color, to spend more of their household income on rent, and less likely to have emergency savings. COVID-19 has exacerbated existing inequities, but it also presents an invitation for us to evolve and to really change the relationships that shape our housing ecosystem. So under the CARES Act, some renters will receive one-time checks of $1,200 and additional unemployment benefits of $600 a week, an amount that will only go so far in high-cost cities like Boston. In Massachusetts, we've recently passed important legislation that halts the different stages of the eviction process, prevents late fees for missed rent payments, and establishes a forbearance period for certain types of property owners. Boston and other municipalities are standing up new rental assistance programs to prevent households from falling behind on rent. We're collaborating on mortgage relief for homeowners, and we are having really hard and at times uncertain conversations about the potential impact of long-term losses of rent. The numbers for these discussions are not always easy to find, particularly as we try to answer questions about how much renters can afford to pay or will need and for how long. According to analysts by CoStar on April 1st, renters owed about $22 billion in rent. In their nationwide survey, the National Multifamily Housing Council found that 69% of apartment tenants had paid their monthly rent by April 5th. And I think it'll be really interesting to kind of watch that number as time goes on. Understanding these numbers for Boston and really listening to the voices of renters and other actors as they are weighing really difficult decisions in this moment will be important both to our immediate response, but also as we think about longer term recovery efforts.
All right. Great, thank you, Taylor. And I want to move on to our fourth panelist. Rebecca, can you give us a sense of the bird's eye view of the mental health and social services situation as it stands?
Yes, thank you for having me today. At NASW, our focus is on advancing social work practice and the profession and advocacy on issues of social, economic, and racial justice impacting clients and communities that are served by social workers. So I thought it would be helpful to give a little bit of background about the earliest days of the social work profession. Social workers have always centered their work around the so-called social determinants of health. And by this, I mean social workers observe problems in one-on-one or clinical situations, and then look carefully at what the root causes of these problems are in the context of our larger society. Typically, social workers find that clinical issues can be addressed with bigger picture policy solutions. And that's in part why I was really excited to be asked to join this panel today, because I know we're going to be really solutions oriented and thinking towards the future. But it is important to point out, as we have all mentioned, that we're in the midst of a crisis that is novel, and it's exposing the cracks, and I really should say craters, in our social welfare system in America and here in Massachusetts. We are the richest nation on earth, and yet more than 12% or 48 million Americans were food insecure before the crisis hit. We know that kids who are food insecure are at a higher risk for developing asthma, anxiety, and depression, and have worse outcomes in school. People of color are dramatically and disproportionately affected by hunger and poverty. 22.5% of Black households and 18.5% of Hispanic households experienced food insecurity in the year 2018. Here in Massachusetts, we know that more than 50,000 children live below the deep poverty level, Benefits that are meant to lift them up haven't increased in decades. We have low-income communities of color that have average life expectancy rates that rival war-torn nations right here in our state. And again, this was before the pandemic. So right now we know that the diseases of despair, as we call them, like substance use disorder, anxiety, and depression that result from poverty, lack of opportunity, and oppression, to name a few, had already been on the rise. But now the risks are even more pronounced. From a recent report by the Meadows Mental Health Policy Institute, the pandemic itself and the economic impact of the mitigation efforts that we're experiencing are both expected to result in direct increases in rates of mental health and substance use disorders, including deaths associated with suicide, overdose, and violence, especially domestic violence. previous analysis by the Meadow Institute, which is based in Texas, of the potential effects of natural disasters on mental health and substance use disorder rates, found that most trauma impacts manifest 60 to 90 days following exposure to the stressors. In this case, and they looked particularly at Hurricane Harvey and the impacts after that. In this case, the sustained and unpredictable length of the pandemic may change that pattern, and these effects can continue to manifest in mental health and substance use disorder related morbidity and mortality for years. Researchers have consistently found that increased unemployment is directly associated with increases in suicide. And for every person who dies by suicide, many more experience suicidal thoughts and more still experience mental health and substance use disorder associated with suicide, especially depression. So what now? Well, in some ways, I would say this pandemic, by showing us our vulnerabilities as a society, is going to give us reason to make substantial and meaningful change to the way we care for each other. Throughout my career, I have often found myself in meetings where people talk about the need to promote self-sufficiency, that this should be our goal. And I have always struggled with that frame, as it feels totally divorced to me from the realities of our human experience. I would ask each one of us listening today, am I self-sufficient? Did I raise myself up and teach myself life's lessons? Did I teach myself to ride a bike or solve a difficult math problem? Each one of us is reliant on others in order to survive. So ultimately, I would challenge us to change our frame, to instead ask ourselves, how can we create a society and a commonwealth, a community that harnesses the power of our collective good? And I would further challenge us to start by advocating for policy changes to lift up those most marginalized and most oppressed, because by doing so, there will be ripple effects across society that will reward us all. We have seen this, I would just add, and I know my time is limited as all of ours is, with increases in, for example, the minimum wage, if you're looking for a specific policy initiative. A lot of the reason why NASW has always been leading and fighting on issues around the minimum wage is because when you raise the minimum wage, you don't simply lift up the lowest income workers, you lift up the workers a rung above and a rung above. All boats start to rise up when you pay close and careful attention to the lives of the people who are frankly, at that lowest level economically. So I look forward to this discussion, and thank you very much.
All right, thank you, Rebecca, very much. So I'm just going to take a point of privilege here in terms of the plan. So obviously this was originally scheduled for 3:30 to 4:30. I had to spend the first 10 to 15 minutes just introducing the conference and the panel. So I'm going to just state now that in order for us to have a good, robust conversation, because I know this is going to be a great conversation, we may go a little bit over 4:30. And presumably most of you are going to stick around for the happy hour anyway. So we're good. So with that, I want to start with the first question, and it's a very general question. It starts with the idea that, right, where are the solutions, right? Where are the challenges and where are the solutions? Where do we have to innovate? And one of the things that stands out to me, and it stood out to me in basically all four of your talks, which were fantastic and really gave sort of a quick primer on what's going on here, is there's this distinction, right, between two populations that are being challenged right now, right? We have let's call them the existing vulnerable, right? The people who were already unemployed or at risk for becoming unemployed, chronic unemployed, as it were, students who were already struggling in school, people who are already struggling on their rent, people who already required extensive mental health and social services, that population. Right. And now we have this new population of what we might call the new vulnerable, right? People who were hit so hard by this pandemic in unexpected ways that suddenly lost their job, suddenly lost all income. And that hits both labor and housing right there. Their kids no longer go to school, but they don't have broadband in the house and they're falling behind every day or every week on their schoolwork. Or, Rebecca mentioned in a prep call for this, someone who is, say, schizophrenic, is possibly already paranoid that anything like a Zoom meeting is already tapped by the government, and how do you get them services, right? And so these sort of extensions of vulnerability. So I want to open the question, and I want to ask Taylor first, to share with us some thoughts of how do we innovate about this, and do the policies we already have in place for supporting the existing vulnerable, do they apply? Do we just transfer them over to the new vulnerable? Do we need to innovate and come up with some new kind of idea for helping those individuals out at this time? And just because this is, BARI's theme, right? To what extent could data be useful, right? What would we need to know to even be able to answer that question? So Taylor, if you want to take first stab at this.
Yeah, and there are like a couple of questions nestled within the one question that you posed. So I'll try to unpack them by starting with this kind of this question around the folks who are already experiencing vulnerability, and this new folks who are experiencing vulnerability perhaps for the first time or in a very a new way, given some of the changes that we've seen. So in housing, we know that there have long been households who have struggled to be able to pay rent, to struggle in order to gain access. And so I think some of the solutions that we already have in place for those populations need to be ramped up. We really need to increase the safety net that folks have access to and increase the aid that we're offering to folks who are already struggling. And then we also have a number of folks who are experiencing new types of vulnerability. So we're perhaps already on the margins, but I'm thinking of folks who are unhoused, who in this moment are really struggling, especially if you are released from the hospital in this moment and don't have a place to go. This access to housing for folks who were already unhoused is becoming even more of an issue in this moment. And I think in terms of the folks that we're seeing kind of enter into new types of vulnerability, I'm hearing a lot about landlords, particularly small, like mom and pop landlords, who are really struggling in this moment as their tenants are struggling to pay rent. So it really shows the connections between all of these different types of actors who operate in this ecosystem and maybe see themselves as kind of separate or segregated. But I think in this moment, we're really coming to terms with the connections between all of these different players. And then in terms of the solutions that we have and where there is perhaps space to innovate, in addition to space to kind of deepening the work that we're already doing, I think really having some hard conversations or new types of conversations about rental assistance and who qualifies for rental assistance is something that we're really exploring in this moment. And I think we're also kind of attempting to hold some of the conversations that were happening before COVID in terms of how we were responding to our affordable housing crisis. So how can we both in this moment really meet the needs of folks who are already housed and need help paying rent, but also not forget that you need to be producing new housing, and how can we kind of have those, hold those things simultaneously. I'll stop there, but the last thing that I want to say is that I think given we're in this moment where more folks are spending time in their home because we are really instructed to stay inside, the quality of our housing stock is growing in importance. It was already important, but I think more people, as they're spending more times in their homes, questions about mold, about air quality in our housing is going to become even more important to talk about.
Yeah, that's great. And actually, just to plug we haven't put it in a slate yet, but we have a panel coming up sometime over the course of the conference on pollution, and a talk on pollution within the home as opposed to just outside the home. And that's a really interesting point there, that that suddenly becomes way more acute right now and something we need to think a lot about. I want to turn to Nancy quickly, and then I think Alicia has some thoughts on this as well. But Nancy, if we think about students, because you noted that there's going to be this vast variability, right, in where students are in September, presuming we're in schools in September, right? how does that change the way that we should think about assessment and support and curriculum, right? How do we approach that? What does it mean to be a second grader, right? In September 2020, and what do we need to do to transform things?
Yeah, and I think you raise a really good question. And when we think about how do we break this open and break the mold, I think when you think about a second grader now who's missed a third of his school year, are they really in third grade in the fall? And that might vary significantly on whether or not their schools were able to provide online instruction that a second grader can engage in, or their parents were able to help them do that. And it's not fair or right to the student to have them come in the fall and expect to be in third grade and be so-called held back. So how do we really think deeply about the kinds of competencies and the kinds of knowledge we expect students to know at various grade levels or ages? And I don't think we can come back in the fall or come online in the fall, or however it is we are in the fall. I don't think we can pretend that the old model of grade levels that start in September and end in June apply anymore. And when we think about assessments, I think we need to really think deeply about what we want kids to learn and how we want them to learn. And here is where I think we have to do it to deal with the vast inequities and variabilities that students are going to come into school with. But I also think it means we have an opportunity to think very carefully about what we want kids to know and how we want them to know it. And I think this applies particularly in high schools, where we're really thinking about the kinds of ways in which we're preparing youth, not just in the basics that they should know around basic skills and competencies, but how are they applying it? How do they see themselves in relation to their schoolwork? How do they see the work that they're doing outside of school relating to careers? Really thinking about the kind of differentiated learning, about the divergent thinking, the kinds of mindsets that we really want our youth to know as they engage the 21st century job market. And so as we think about assessment, it gives us an opportunity to really sit back and think about, what do we want kids to know? And to your other question around the newly vulnerable, and I think that the vulnerable kids that we already know are vulnerable academically are even more so, because they're the ones whose families have lost jobs, have unstable housing, have less access to the internet, have schools that are not able to provide the kinds of interim instruction. But the newly vulnerable from an education perspective are those who are older, who are now perhaps working even in the gig economy to provide for finances for their families, that may not come back to high school. And so we're going to see an increase in dropout of those who have found their ways into lower level jobs that are providing support for their family, and they can't go back, or they don't feel welcomed back, or they don't know how they could possibly come back given how far behind they are. And another newly vulnerable population are those in the transition. I think about those who are transitioning from high school to college that are unsure if they're even going to be able to go to school, or what is going to college look like in the fall if it's online. And I think those are kind of two newly vulnerable populations.
All right. Thanks, Nancy. And I find your thoughts about how to think about content versus application really interesting. It reminds me of the transition that occurred in higher education during the Great Recession, where we started focusing more on project-based learning and profession-based education, because people realized that investing in a degree that was just a degree, and there was no guaranteed job on the other end, which was always the kind of thought. So that's really interesting, and seems promising.
And if I could add to that, I think we need the kind of vocational training, and we need to deeply think about vocational training in a way we're not now. But I don't think that means that we're only preparing for vocations, that we've lost the value of arts and humanities. I think if anything, being confined and stay at home means we need more arts and literature. And I think the kind of creative thinking and divergent thinking that comes with being exposed to arts and music and literature in combination with vocational and more purpose-driven career training.
All right, great. Thank you, Nancy. Alicia, I want to turn to you because I mean, your area of expertise really lends itself to this question of the new versus the old vulnerable, right? People who are already at risk for unemployment versus people who just got blindsided by a train right now. What is the next year? What do the next 3 years look for like for those populations? And how does the government and nonprofits think about supporting each of them? And should they be thinking about them differently?
Yeah, so, probably not too surprisingly, just like every system, the pandemic has exacerbated is existing inequalities while creating new disparities despite our best intentions. So it's probably no surprise to anyone that the job losses we've seen already have been disproportionately borne by people of color. A recent national survey done by Strata shows that 25% of African Americans and 22% of Latinx people have been laid off compared to only 15% of whites, and upwards of 66% of people of color have experienced a reduction in income compared to only 51% of whites. So it's bad for everyone, but it's worse for the populations that we typically have seen as most vulnerable. The other thing I wanted to highlight was that in the category of new disparities, low-wage essential workers are probably not being adequately compensated for the work that they're doing. I saw a little bit of this in the chat just now. Many of these essential frontline jobs pay relatively low wages at a time when unemployment benefits are exceedingly generous. So the CARES Act right now significantly increases the generosity of traditional UI benefits by extending the benefits for an additional 13 weeks, but also providing this additional $600 per week beyond the usual benefit. What does that mean? So what that means is that, for example, if you look at job postings on Indeed.com, a full-time grocery store cashier or clerk makes $12.75 an hour or $510 a week on average. Under the traditional UI program, they qualify for a weekly benefit of only $255 a week because we usually only replace half the wages. But right now, under the CARES Act, with the extra $600 a week, they actually would earn $855 a week or 68% more than their pre-employment pay. So the intention was to ensure that all those who were most likely to be hurt are able to meet their basic needs during the crisis and have money to spend when the pandemic abates. But our current low-wage workers who continue to work and those whose jobs have become even more valuable to society in the crisis are now actually probably not being compensated the way they should be for taking on these risks. And so you see some employers increasing wages to attract workers to these jobs who are taking on health risks to provide these essential services, such as nursing home attendants that are in high demand. And in other states like New York, the governor is even calling for frontline workers to receive hazard pay bonuses during the pandemic. So we've seen this kind of twisting in terms of who is vulnerable and how are we taking care of them. One of the other things I wanted to highlight was that, we learned some things during the Great Recession. I think this is kind of the theme that you've been going with. And what are the things that we should be putting in place now that were probably always good ideas or things that we should have been doing? So one of the things we learned last time around is there's a non-trivial number of these jobs that get destroyed during a recession that are not going to come back during the recovery. And that's because firms often use the crisis as an opportunity to adopt technology or rearrange production. So for example, lots of middle skill manufacturing jobs were outsourced or automated during the last recession due to the financial pressure to cut labor costs. And it's likely we're going to see an acceleration of this trend towards technology adoption as the benefits of restructuring workplaces in ways that minimize close human contact become more apparent during the pandemic. And someone in the chat was asking if anyone's doing research on these kinds of things. And I'm hopefully finishing up a grant application to the NSF looking at just this question in manufacturing about the acceleration of technology adoption. The other thing that we learned was that employers tend to respond to economic downturns by increasing the skill requirements for hiring new workers. So right now it's a buyer's market in terms of hiring. So employers can afford to be choosy. They can put lots of extra requirements on their job posting at a pretty much low cost to them. And so what you find is that lots of jobs that previously only required a high school degree are now requiring a college degree or more years of experience or other types of skills. And so that's something we saw in the last recession that we really should do a better job in terms of making sure that skill requirements reflect the needs of the jobs and not just employers who are looking to sort of upskill their workforce. And so some of the ways we can think about addressing these kinds of mismatches is looking for government and educational institutions and training institutions to pursue sort of these sector-based strategies to fill jobs that are in high demand, but ensuring that the education training that's provided is in line with what employers are looking for. And then I guess the last population I would talk about in terms of vulnerability with the labor market right now is working families. So as someone who has a second grader at home, along with 3 other kids and is working full time, I can say that it's not an easy juggling act. And so we're actually launching a study looking at how these caregiving work arrangements have changed during the pandemic, and then what supports could be put in place in terms of employer practices and also labor market policies like paid family leave and those types of family supports to be able to support people during this time, and then also in other times of crisis that aren't as widespread.
All right, thank you, Alicia. So I want to be mindful of time. We are going to go over a little bit. It's already 4:32, although we may lose one of our panelists shortly. So I want to ask a question of Rebecca to kind of jump in here, and then I want to move to a lightning round question. So Rebecca, I'd love to hear from you, right? So back to this idea of emergent opportunities, right, as opposed to missed opportunities. What are our opportunities right now? What do you see as the things we can do, that we can learn if only we're attentive enough and only we're action oriented enough?
Thank you for this question. I absolutely love this question. We must prioritize rebuilding our social safety net. That is absolutely number one thing I think we can do to improve issues around mental health and to improve issues around the wide variety of things that we've talked about, including housing and other problems that people experience. I think that if this pandemic has taught us anything, it's that to a certain extent, we're all vulnerable, right? That far too many of us are one paycheck away from financial ruin. So what do we have that's holding us up? We have ways that we can fund social programs. We should roll back corporate excess. We should roll back that huge tax giveaway that was signed into law in the federal government that was just a handout to the wealthiest people on earth. It's inexcusable. Trickle-down economics doesn't, well, I'm not the economist on this panel, but I think we can all agree that trickle-down economics does not work. It has never worked. What we need to do is lift people up from the grassroots up. I don't know if any of you have seen, but the New York Times is running these pieces. They ran a piece recently called "The America We Need." And in it, they talk about Roosevelt's comments at the Democratic Party convention in 1936, when he said, "Liberty requires opportunity to make a living decent according to the standards of the time, a living which gives man and woman not only enough to live by, but something to live for." And I think that is what is needed now, is big work opportunity programs, big programs that are initiated on the state and federal level to give people jobs and opportunity, and a rollback of the corporate excess that we have seen over these past few years.
All right, great, Rebecca, thank you very much. So I want to wrap up with a last lightning round question. So each of the panelists, 30 seconds. I know that's undue torture for people with PhDs and masters, but we're going to do it. So one of the things, and this has been coming through a lot in the Q&A, if you guys have been looking, questions about well, how do we do this, right? A lot of these things we're suggesting, and these are fantastic ideas everyone's putting out there, but a lot of these require fundamental reorganization of systems that some might call subject to inertia, others might call calcified, depending on what word choice we're going for here. So with that in mind, and keeping in mind as well the other theme of this conference, which is co-creation, right? What does collaboration look like? Who are the players? Who needs to be at the table? And how does this happen, right? If we want these things to happen, how do they happen in the next year, next 3 years, whatever it might be? So I'm going to turn to Taylor first, because I know, Taylor, you have a very pressing meeting to jump over to. And thank you so much for making the time. I understand policymakers have a lot of pressure on them right now, given your role. So thank you. If you want to jump on this one first.
Yeah, so where there are opportunities for co-creation and collaboration is the question.
Yeah, and where does it come together?
Yeah. So in some ways, what's really exciting is that we're already starting to see this. So I'm thinking about some of the things that have come together in the past month in terms of before the state had passed its most recent legislation. The city of Boston had worked with some of the largest landlords of affordable housing and MACDC to really put together a voluntary eviction response, a step towards creating a bit of a voluntary eviction moratorium. And so that was an instance of these different actors really coming together and really seeing that it was in everyone's best interest to really think about a solution that could come together really quickly. I think we're also seeing that in conversations that we're having with lenders. So the city has worked with 13 lenders to really put together a mortgage relief program for homeowners. So I think that we're starting to see these different sectors see that our fates are linked and shared. And so it is really in our best interest to come to the table together. I think we also, as we kind of look towards the future, we have to be prepared to start spending even more when it comes to producing new housing. And so that's at a federal level, that's at a state level, and that's at a local level as well. And I think that we need to kind of revisit our conversations around the role that zoning and thinking about housing production plays in our long-term recovery process. And so that will bring new sets of stakeholders to the table as well.
All right, great. Thank you, Taylor. Very helpful. I think a great way to sort of map out where we go next here and who the collaborators are. And thank you for joining us. I know you have to go. But from there, I want to turn to Alicia, because I think there's a similar theme there of these, what we tend to think of as different private actors with different incentives who might be compelled or motivated even to come to the table together right now. What does collaboration and co-creation look like in the labor space?
Yeah, it's interesting. I would say in the labor space, maybe as in other places, we actually know a lot about what successful collaborations look like. We just haven't done enough of it or brought it to scale. So in the labor market, successful collaborations typically are these sector-based strategies or partnerships that I mentioned before. So a sector strategy is a partnership of employers within a critical industry, say healthcare, that brings together education, economic development, workforce systems, and community organizations to identify and collaboratively meet the workforce needs of that industry within a regional labor market. And so everything is local, right? Housing is local, so is the labor market. Even though we are all interconnected, there are very important regional differences to pay attention to. And this is really kind of the new model that we've been going with since the end of the Great Recession, to move from kind of this program administration oversight focus to a more strategic role building on the regional level, to create talent pipelines, to address the skill gaps that I mentioned before, to create meaningful career pathways for people in these important regional industries. And so really to create an effective means for workers to attain industry recognized credentials and to achieve success that's longer term. So for example, here in Massachusetts, the Boston Healthcare Careers Consortium brings together employers, educators, workforce system partners, I think even on a monthly basis when they meet, to promote healthcare related education and training opportunities that align with industry needs. The group was created specifically to address these labor market mismatches and to try to address them through local education and training of the existing workforce. And they found that to be really necessary because even though we are a hub of healthcare innovation and we attract many wonderful physicians and physician groups, and we have world-class hospitals, they found that it was really limiting, that we didn't have enough middle skill workers to be supporting those other players in the healthcare market. So for example, in the surgical room, right, you have the surgeon who's conducting the surgery and you need the technician to be able to hand them the scalpel. And you can't do that job without having both of those pieces. More recently, the Greater Boston IT Tech Consortium was launched in 2016 as a sector-based strategy that was led by Greater Boston area employers with the need for an IT tech workforce pipeline. And again, this was created out of the need to fill these kinds of jobs, and was in partnership with the Boston Private Industry Council and SkillWorks, where they help these employers identify how to narrow these skill gaps, increase diversity, which is incredibly important in the IT industry, and provide greater opportunities in IT for all Massachusetts residents. And some of the things they do include things like providing industry reactions to labor market information. So when we see big changes in the labor market, what does that mean? Guiding system and program development based on needs and expertise. So again, keeping close contact with education and training programs to provide the skills that employers are actually going to want to hire in people, and supporting these different education and training pathways to promote system change. And then there's a community-based organization piece that goes to wrap around all of these services to be able to provide supports for workers to be able to persist in an education or training program, because a lot of the individuals that we're serving are folks who are on the margin in terms of being able to stay in a community college program, stay in a training program to get to that next level.
All right, great, Alicia, thank you. And there's a lot there about education and training, so I think that makes for a natural segue to Nancy. What does the table look like?
Well, the table includes the businesses, and I think it includes the businesses in part to talk about what the future workforce needs, and so that particularly in high schools, that students can have the kind of internships, can have the kinds of practical hands-on experiences where they see the topics that they're learning in school apply to the workforce. I think we need stronger connections between what secondary schools are providing and what the labor force needs, in addition to just strong vocational training and college prep training. At the table also is the state in terms of thinking about what are the requirements across the grade levels. Like right now we are in the middle of a natural experiment here in Massachusetts, and so this year the 10th grade MCAS test is not a requirement for graduation. And so a test that has been a gatekeeper, particularly for students who are English as a second language learners, ELL students, have found the MCAS as a barrier to graduation. Well, they're going to graduate. And so what does that mean for their success and the validity of that test as a gatekeeper to graduation? So I think we can think more systematically about graduation requirements. So the state policymakers are at the table. Measurement people are at the table in terms of assessment and the ways in which I talked about before. Tech support's at the table, because I think we need teachers to think about technology, but I think asking them to do it in the nights and weekends and spare time and planning periods is a losing game. And so we need to be able to provide families and teachers with the kind of tech support and tech innovative ideas so that they can incorporate technology into their curriculum, so we can potentially eliminate snow days here in Massachusetts if we can really think about online education. We can really think about flipped classrooms, where instead of asking kids to go home and try to practice the things they didn't understand, they can go home and watch lectures and let teachers do what they do best in the classroom, which is apply and innovate in the classroom. I think we have students at the table, and not just the students who are learners, but I think we have a real opportunity right now to bring in our college students, our recent college graduates who are going to be looking for jobs, and bring them as wraparound people who can support students, the younger students, in terms of tutoring and catching up and things like that. There's a real place to bring in people who can come into alongside students and help them catch up and fill in those gaps. So those are the people who are at the table. So the students, the teachers, tech support, local businesses, policymakers, measurement people. It's education. Everyone's at the table.
Yeah, just a few people. Just a few people. So, all right,
Families
thank you, Nancy.
are at the table.
So Rebecca, you presented a really aspirational view on the last question. So take us home. Who are the partners that need to be on the table in your space?
So this is what we do at NASW. We bring folks together in coalition. We participate in coalitions to advance public policy that benefits the social workers who are out on the front lines doing this work. And like I said at the beginning, clients and communities served by social workers through issues of social, economic, and racial justice. The people at the table are the people that that have been at these tables, but the tables need to expand. They need to be bigger. It's nonprofits, it's community-based organizations, it's religious groups, it's state and local leaders. Let's not forget that some of our politicians are incredible leaders in these fights, and impacted members of the community. Everybody needs to have a voice there, coming together to decide how we want basically our communal tax dollars spent. Which programs do we want to fund? How do we want to fund them, and when? Paul Wellstone once said, all government is taxing and spending. It's just, who do you tax and what do you spend it on? And I think our coalitions have had great success over the past few years. Here in Massachusetts, we've seen tremendous gains on some of the things that we've worked on over many years, things that I thought would never be possible. So for many years at NASW, we worked in defensive mode around issues of welfare, for example, transitional assistance to families with dependent children, where people would say there's fraud and abuse or whatever they wanted to say that was just frankly not true. We didn't think we would ever get proactive movement to expand benefits, but we did. Last year, we worked in coalition to lift the welfare cap on kids, which denied a second kid in a family the opportunity to get any benefits at all. Massachusetts was one of only a few states that had a cap on kids. And our legislators, with our advocacy, with our coalition partners, said, we are not going to do that anymore. These kids were eligible for no benefits, including the yearly children's clothing allowance. So that's gone now. And now we're a state that doesn't have a cap on kids. So I often will tout that it seems like these things are too big, or it seems like we can't do it, but we have seen success. And if we are strategic, if we are focused, if we are thoughtful, if we have the right people at the table, we can absolutely come together on policy priorities that will make it so people have a chance to have a good life free of despair. On our website, you can find some of the things we're working on now at naswma.org. We have some emergency COVID-19 related initiatives that are related to some of these issues. Some things have already been on the move and things continue to move forward now. So if anybody is out there who wants to get involved in any of these efforts, please do reach out to us.
All right, great. Thank you, Rebecca. And thank you to all the panelists. Thank you, Nancy. Thank you, Rebecca. Thank you, Alicia. Thank you, Taylor. This has been wonderful, enlightening, and really, I think, lays out some great ideas for how we move forward. And that is the theme of this conference over the next 15 weeks. And we hope you will all continue joining us here. And I think really the hope here from my perspective is we in Boston, we have experts in many domains, and we have a richly collaborative research policy ecosystem, civic data ecosystem, as we like to call it. And so there's opportunities to solve this together and to innovate together and to co-create together. And maybe we come up with solutions that not only help out Boston, greater Boston, Massachusetts, but also the entire country, right? We can transfer those and share those with others. So that's our hope. Those are the conversations we're having for the next 15 weeks. Please join us next week. This was a nice lead into next week's will be the theme of the conference, co-creation. So please join us then. We're about to transition over to the BARI happy hour. We're going to take 5 minutes so I and everyone else can go get a beer or whatever your cocktail of choice is. It does not need to be alcoholic, but me personally, I'm going to go get a beer. Yeah, so it's bit.ly/BARI happy hour. That should be in the chat. And if you're asked for a password, we don't believe you will be. The password, if it asks for one, is BARI, B-A-R-I. And let me just send that to everyone, all panelists and attendees, because I think, I believe that Will just left in order to start oh, there we go, to start the happy hour. So thank you all. If you join us there, you'll be able to turn your camera, you'll be able to talk to people. It'll be great. Otherwise, thank you for joining us. Have a great evening, and we look forward to seeing you back here next Friday. All right. Bye, everybody.
Thanks, Dan. Thanks for having us.
Bye. Thank you for having me. Bye-bye.
Thank you.